Hello, this is KSQD Santa Cruz and KSQT Prunedale. You are listening to Talk of the Bay. I'm your host, PK Haddis. In June, healthcare providers, elected leaders, and community advocates gathered in Watsonville to celebrate the grand opening of Encompass Community Services' new state-of-the-art Se Puede Behavioral Health Center. While Encompass has been providing support to those struggling with mental illness and substance use disorder at facilities in Watsonville for decades, this newly renovated health center offers the nonprofit not only an opportunity to expand its footprint and increase the overall number of patients it is able to serve, but it also gives community members a safe, quality facility that is conducive to stability and recovery. While the ribbon-cutting ceremony marked a proud accomplishment for Encompass, which has spent over a decade trying to get the project over the finish line, I thought this project also presented an opportunity for us to hear from the experts about the condition of behavioral health treatment programs in Santa Cruz County more broadly. What has helped them improve services in recent years, and what challenges now threaten that progress? I'm pleased to be joined by Encompass Senior Manager of Adult Residential Programs, Jillian Reed-Nauer, and Program Manager Jorge Gutierrez. Jillian, Jorge, welcome to Talk of the Bay.
Thank you.
Thank you.
Glad to be here.
Glad to have you both on. Thanks for making the time. Jillian, perhaps I can start with you and ask if you could give us a summary of why this latest project, the Se Puede construction effort was needed. I mentioned it was many years in the making, I think a decade. Could you just tell us about why this project was so sorely needed?
Yeah, so, the need for behavioral health services in Santa Cruz County is it's very needed. There is never going to be enough resources. I will tell you this particular project is unique because we will be opening some withdrawal management beds in this facility, and we're going to go to 30 beds total. So about 8 withdrawal management and 22 regular residential level of care. What we've learned over the years is that clients are getting more acute in multiple ways. And the assessments that we do prior to somebody coming in determine the level of care. And what we were recognizing was in South County, there was a lack of available resources for withdrawal management, and available resources for treatment that celebrated the Latinx community, and really honored those traditions. Se Puede has gotten a really special reputation to the South County community and all of Santa Cruz, really, for being the only treatment facility that provides the treatment in Spanish as well as English, without interpreters. It is fully readily available for clients that are monolingual Spanish speaking. I don't know if you want to ask Jorge, who is there more on site and has been with us like 30-something years.
Well, that's fantastic. Thanks for that introduction to Jorge. And I was going to kick it over to you, Jorge, and ask if you could just elaborate more about what sorts of services are offered from this health center in Watsonville.
Yes, the Se Puede Behavioral Health Campus offers refers to outpatient services, individual and group counseling, medicated assisted treatment, and different evidence-based practice modules, such as motivational interviewing, trauma-informed care, referral to doctors. Also, we offer, nurse care management, care coordination, among others. Then that's a big difference. That's a big support for our clients. Because many times they're not connected, to their PCPs or the clinics, even though they have the benefit of having a Medi-Cal, they're not using it the right way. Mm-hmm. Then Se Puede offers all these services to the clients.
Could you tell us more about the sorts of clients that you see? Maybe you mentioned that there's bilingual services, which is a great feature of this institution you all have down there, which again has been there for years, but this latest project was basically just revamping it completely so that the facility was, as I said, state of the art. But could you tell us about the populations that this facility is serving? Because I'm getting the impression that they sound like they're typically underserved, and that's why it's so important for this this facility to be down there. So perhaps you could tell us more about them.
Correct. Yeah, but the Latino community in the South County has been kind of like, let's say, what I would say, like forgotten for many years. And that's why Se Puede came about to support the Latino population with substance use disorders. For sure, we work with other ethnicities, but mainly these underserved, clients that they don't know where to go because the services, many of the services are lacked in Spanish, given. Then Se Puede offers that. We work with clients, but with homeless, status. We work with individuals who've been there for years struggling with substance use disorders, and now with all these new drugs, it's harder, hitting, the Latino community in a big, great aspect. But then many of them, they have destroyed their families, and they have, they say in the street, they have burned many bridges, and these clients are very connected with the criminal justice system, and because many times they don't have the right representation, and many of the crimes are committed under, when they under yes, exactly. Then under the influence, we could say. Then that's why they don't know where to go, and then many of them, they don't have hope where to go. When they come to Se Puede, discover there's a safe place where they can develop and learn more about their addiction status.
Jillian, I want to revisit something you said in your first answer, which is clients are more acute in multiple ways in these days. So could you just elaborate on what you meant by that?
Yeah. So, as we move along, the drugs have gotten harsher. They do more damage on people's bodies. The cost of living is higher, so it's harder to stay on your feet, get on your feet. And so we see more and more people that are either spending more time in institutions. So maybe they are more acute because they have more PTSD because they're in prison longer. Maybe they're more acute because they've been homeless and their nutritional, daily supplement is lacking, if any. Maybe they're more acute because they've drank so much that they need organ transplants. Maybe they're more acute because, they've had abscesses on their legs, which now leave them with impaired mobility. Maybe they're more acute because that lifestyle is so hard, they struggle with mental health acuity that has increased due to both lifestyle trauma and substance use.
Mm-hmm. Right. And that just makes me think, just having covered these issues during my day job at the Santa Cruz Sentinel and hearing from folks and experts like the both of you, when it comes to behavioral health issues, it might appear that it's sort of straightforward and obvious to someone from the outside looking in. But as you speak to experts and folks who directly engage with these folks on a regular basis, you start to see that substance use disorder and mental illness, they're so often tied to other economic issues or political, social issues. And that's one of the things I'm immediately reminded of just hearing in the few minutes we've had together. Would you say that that's kind of an accurate interpretation, or has that been your experience as as people have spent years in this work?
Absolutely. I don't know if anybody has tried to be homeless for a year and then get up and go get a job, but who's going to hire you when you're dirty, smelly, you sleep during the day because it's safer to be up during that time, you haven't eaten regular food in a while. It's so hard to maintain just the actual lifestyle change, but then there's the actual part about like what this does to your brain and your body. You know, it's no secret that, I think there's okay, let me start by saying this. In residential, you assess into residential. It is a high level of care. It's like you don't go into a skilled nursing facility for a headache, right? Mm-hmm. So the clients that Jorge and I serve at these levels of care are not people who struggled a little bit, right? Like these are folks that it is now ingrained. The habit is ingrained. They are living on their fight and flight mode and their reptilian brain. They are not using logic. They're using impulsive decision making. They are not able to think past how am I safe, how am I sleeping, how am I eating. And the thing that I learned really early on is if you want a safer community and you want people to be more productive in your community, help them. Because the reality is when somebody goes to jail, even if they're going to prison for 20 years, they will get out. They get out. And so why would we not have a place for them to go where they learn a regular schedule, they learn impulse control, they learn anger management, they learn how to do the chores, how to get up, make their bed, eat food, take their medication, see a doctor, get their teeth fixed, and get clean clothes. And bonus, they learn how to get along with each other so that they can be civil in society. Again, these aren't folks that need a little help. These are folks that they've been through a lot. Mm-hmm. And the worse the political climate gets, the harder it is for them to access treatment, the harder it is for us as providers to maintain the facilities to provide the treatment, the harder it is for people who do our job to withstand what they see and experience in the face of threats of closure. The harder it is to access food, the harder it is to get compassion from fellow humans.
One aspect of this treatment center is the availability and the expanded availability of residential beds, like you mentioned off the top, Jillian. Jorge, I was wondering if you could just, my understanding is that is a crucial feature. It's maybe an easy one line of expanded beds, but could you just tell us why beds are so important? Because there aren't a lot of them in Santa Cruz County, as I understand it.
Yeah, and that is correct. But as we are a non-profit organization, the Se Puede. I mean, I remember that we were at 23 beds, but we didn't offer withdrawal management. In Watsonville, the expansion is of beds. It is to serve more clients, more acute clients, as Jillian was explaining. And also, we didn't have withdrawal management in the whole South County. You needed to go to the hospital in case that's an extreme case. But just having that expansion of 8 beds available for withdrawal management, that makes a lot of changes. There was another program here in Santa Cruz, they have only about four beds, but they were struggling too. Then, with this expansion of about 22 residential beds and 8, beds for withdrawal management, that will extend the support to, the South County, population. And mostly Latinos, because Latinos, they don't have many services in Spanish in the South County.
What's the makeup across Santa Cruz County in terms of those struggling with? Feel free to categorize it once you hear my question, however you think is easiest to sort of answer it. But what does the makeup look like when it comes to substance use disorder, for instance, or mental illness or homelessness, for that matter? Mm-hmm. Any one of those kind of jump out to you that you could describe for us, how prevalent the issue is in Watsonville versus Mid-County versus Santa Cruz, say?
Yeah, I can talk in about Watsonville. Watsonville, just think about this. In the beginning of, I've been there for 35 years, and then I have, you know, I know a lot of changes in the community, and then that has occurred. In the beginning, think about that. I was just the first alcohol and THC, and then cocaine appear, then followed by heroin, then methamphetamine, and now we're dealing with lethal illicit substances, fentanyl. Well, that portion of the community is growing up with use of fentanyl. Many people that used to use or they were hooked on methamphetamine, now they use fentanyl, and fentanyl is lethal. But as Gillian was saying, I mean, they don't think about it. They just think about the reward they have instantly. Then in the program at Se Puede, we're dealing with few cases of alcohol related substance use. Then but mostly it is methamphetamine, and now it's fentanyl. Then all the people who are many of the people who are using methamphetamines now they went to the fentanyl, and I mean that's really dangerous. Expanding this beds, I mean that will reach more population, in Watsonville, South County.
Right. So part of what we were talking about when we were talking about the having beds available, which in other words, I think a short answer for that is just having addressing the continuum of care and making sure that there's the appropriate facilities for the various stages of recovery that some folks are in.
Correct.
Continuum of care is a phrase that gets thrown around a lot, and I think maybe it's worth pausing, Jillian, if you don't mind, and kind of explaining what folks mean when they use that and why use that phrase and why it's so critical to understanding this issue.
Yeah. So I talked a little bit about that there is an assessment of people we use. So we have a network in Santa Cruz County. We call it the network. And it is providers that take primarily Medi-Cal funding. And we use a standardized assessment. And so what that looks like is people get assessed into these levels of care. So it's withdrawal management, it's residential, and it's outpatient for just argument's sake. There's variations of those levels of care, but those are the primary kind of what people might, that's the broad strokes, right? Mm-hmm. And so the idea is that somebody would go to the assigned level of care, right? And within the network, we have an agreement. We use the same assessment. We refer to each other. We have a very strong connection. And then when that person is assessing at no longer needing the current level of care, then they step down into the next level of care. The idea behind this is that substance use disorder and mental health, they are disorders. They are diseases. They don't go away. Right? They're something that you are navigating for long periods of time, often, most people lifelong. And so working through that recovery and working from the most constrictive level of care that you assess at, right? So like that would be withdrawal management. Then you step down into residential. Withdrawal management is just medical stabilization, basically, with an introduction. You go into residential, you get those skills. You get 24/7 support in learning how to navigate just basically life. Then when you feel that you are ready and safe enough to have more independent life, have more freedom of choice, maybe you step down into outpatient. Maybe you go to a sober living environment. Maybe you go to recovery residence, which is kind of in between. Or maybe you don't. Maybe you go home. But you have that tether, you have that connection, you have that anchor that you were consistently checking in with and being like, this is how my week went. This is when I struggled. Let's talk about that. Or I did struggle. I messed up. And I need to talk with you and figure out how to not do that again because I don't want to lose everything again. And so it's most restrictive to least restrictive, and it can go the other way. And it often does, where somebody goes into outpatient because they don't want to lose their apartment. They have a cat, or whatever the case may be, and they try it and they just can't make it in between those outpatient appointments. And that's when they would slide up into residential. And the idea of the continuum is that we make it as easy as it possibly can be for that person sliding between those levels of care.
Right.
Within the network.
Right. And so to keep that continuum working properly requires a great deal of resources.
Mm-hmm.
And it seems like the last few years, or I should say, maybe between 2022 and 2024, there was some progress, at least locally here in Santa Cruz County, in terms of expanding the number of beds, addressing some of the gaps in the continuum of care. And it seems like that is being rolled back to some degree, or at least we're witnessing the very start of that rollback. And I don't think it'll surprise anyone to know that it seems to stem from federal actions with the new Trump administration and some of the policies Congress has adopted. Could you tell us we have about 5 or so minutes left, so I hate to rush because I know how important this is. But I'm hoping you both can describe maybe some of the most critical aspects on the horizon that you see that are threatening this delicate balance that has been established and is still growing.
Well, you named it. I mean, the federal government trickles down to state, trickles down to county, trickles down to provider, right? And so when all of these policy changes to healthcare happen, it affects the little man, or the frontline worker, I should say, and in turn infects the person.
Are there any policies in particular that jump out to you immediately that hit behavioral health services on the local level especially hard?
I mean, funding for the reimbursement rate that we get makes it really hard. So it's nonprofit, right? So the person in the bed pays for the staff, pays for the rent, pays for the food, pays for and so it makes it really difficult when our rates are getting cut to maintain staff, to maintain being able to pay them a living wage, to being able to maintain, gas, electricity, food, all of these things that are getting more and more expensive. It's a home. It's 24/7. It's always open. And so you have to have a certain number of staff. You got to pay them. It makes it really, really difficult.
Jorge, anything to add to that jumps out to you?
Yes, and also, a big part and a big portion of that is recruiting and retaining clinicians. Also peer specialists and case management. These workers, those are the essentials, to the work what we do. We need to need people that is compassionate, and that really are there and their heart, to help individuals and into this road of addiction. Then if all this, the lack of funds is we cannot compete with the county. The county pays big money for their clinicians or their case managers. But we have a limit at the at Se Puede Encompass. Then but just that's another the recruiting and retaining clinicians are a big part of it.
That goes back to my point earlier about just the confluence of factors really coming together to impact this continuum of care for behavioral health in this case. And what you brought up, housing, I mean, that's another factor that is so critical to this in many ways, right? Homelessness directly, but also for physicians, the cost of living here. It's the most expensive rental market in the nation, and it has been for many years in a row. And that impacts the ability of medical organizations and providers to actually recruit physicians, which is a huge problem here. There's a shortage in all sorts of different sectors of healthcare. We've got just about a minute here left. Jillian, I want to give you the last word. I welcome anything else you'd like to share about this, or put another way, as a parting question. If you had sort of a magic wand to kind of set Se Puede, the center down there in Watsonville, up for success, what are one or two things, if you could wave that wand to make them happen, that you think would really help keep it going for decades to come?
I mean, first and foremost, reasonable reimbursement rates, or at least enough money to hire the staff that we need and pay them well.
When you say reimbursement rates, you're talking about Medicare and Medicaid at the federal level, essentially.
Yes, exactly. Yes. So that reimbursement rate. Or, somebody just magically saying, hey, just run this. But also, what I would really love is the ability to hire staff and have them be happy and fulfilled and feel supportive, and let them do the work that they really, really want to do. Because the people that come to work for us, we don't, it's passion-based. Mm-hmm. It's passion-based. So. Right.
Difficult work, and important to remember that there are people at the end of both ends of this equation, and they need all the support they can get. You've been listening to KSQD Santa Cruz and KSQT Prunedale. This is Talk of the Bay. I'm your host, PK Haddis, and I've been talking to Encompass Senior Manager of Adult Residential Programs, Jillian Ridenour, and Program Manager Jorge Gutierrez. We've been talking about the Se Puede Behavioral Health Center down there in Watsonville, run by Encompass, that just experienced a major renovation. So Jillian and Jorge, I really appreciate you taking the time to explain not only about the health center, but also just about behavioral health more broadly here in Santa Cruz County and on the Central Coast. So thanks so much for coming on Talk of the Bay.
Thank you, PK.
Thank you. Thanks for having us.